powerful drug mixture dubbed the zombie drug is making its way around California, raising new stakes for law enforcement and addiction specialists who say there is no antidote. The drug mixture is made up of what's known as tranq, an animal tranquilizer, and opioids such as fentanyl and heroin.
When taken together, the side effects can be horrifying and often deadly. Action News reporter Kate Emmerich joins us here in the studio with what you need to know about the drug that's gaining popularity out there on the street. Kate?
Warren, Margot, xylazine or tranq is called the zombie drug because it will rot the user's skin, causing it to peel and sores to open. It can also be deadly. Its effects also can't be reversed by naloxone.
A drug with horrifying side effects is gaining popularity across the country. Xylazine, also known as tranq, is a powerful sedative approved for veterinary use only by the Food and Drug Administration, but it's being mixed with fentanyl and other illegal drugs.
So the drug in itself is not an opioid, but mixed with other opioids and then other drugs like cocaine. It enhances the effects. Therefore, they're getting a bigger kick, bigger high, and it's enormously cheap.
According to the FDA, xylazine depresses breathing, blood pressure, heart rate, and body temperature to critical levels.
Here they have fentanyl that causes respiratory depression mixed with a veterinary medicine that causes respiratory depression, so that's why people stop breathing.
Repetitive use can lead to other devastating side effects.
You're starting to get all this vasoconstriction, which causes damage to the flesh. You start seeing infection, you start seeing rotten flesh. That's where you hear of the zombie walk, and you hear about people having rotten flesh and everything. Well, that's just because of a lot of IV users.
If sores or dead and rotting tissue are left untreated, that can lead to amputation. Xylazine is not an opioid, so its impacts can't be reversed by naloxone. However, because it is often mixed with opioids, administering the opioid antidote is still recommended.
You may have to use more, but it's going to help you with the heroin or the opiate, but it's not going to help you with xylazine.
Recently, the FDA announced it is restricting the imports of xylazine. FDA staff may detain ships with the drug to make sure it is meant for legitimate veterinary use. Flint Anderson, with Parents and Addicts in Need, says parents need to take drug risks seriously.
The first thing they need to do is drug test their child. They cannot be afraid to drug test. A lot of parents are because they feel like they're stepping on their kids' rights. And my response to that is, would you rather have your child alive or dead?
On its own, xylazine is a legal drug used by veterinarians, so it doesn't appear in standard drug tests. Anderson says it can be detected with further lab testing. Margot?
Hey, thank you.